here, we look at the Gui-Ji-Tang syndrome, where we have the deficient Winkle, okay, as the pathogenesis. So what do we have in terms of the principle? Really, we are reinforcing the healthy qi and release the exterior. One thing is that we want to reinforce the spleen qi and blood. Okay, that's one part of the treatment method. And the second part of the treatment method is disperse the Winkle from the lung by diaphoresis with warm and pungent herb. So if we break down the herbs in Gui-Ji-Tang, right, reinforcing spleen qi and blood, we have Baisao at 10 grams, Dazao, probably 5 pieces or more, and Zhiganchao at 6 grams. This probably total over 20 grams for sure. And then the second part, we have dispersed Winkle from the lung, which is where we use the combination of Gui-Ji at 10 grams and Sengjiang at 10 grams. That probably total up to 20 grams, right? So definitely you will see at the minimum that the reinforcing dosage is probably at least equivalent, if not larger than the dispersing component. So you can see here, Gui-Ji-Tang is really about first and foremost focus on reinforcing and then dispersing. And at best, they may be at the same time with the equivalent importance. But at no other time where we will see like Ma Huang Tang, which we'll show you in the slide here, where you only focus on relieving the exterior. There is no reinforcement, no nourishing component to it, right? So if you compare the two formulas, Gui-Ji-Tang, you have Winkle, addressing the Winkle pathogenesis by using Gui-Zi and Sengjiang, and you address the blood deficiency components by using Dazao and Baisao, and the qi deficiency using Zhiganchao, right? Comparatively to the Ma Huang Tang syndrome, you have Ma Huang and Gui-Ji addressing the Winkle pathogenesis, and Xinyun addressing the reason of the Ma Huang Tang syndrome, right? Zhiganchao actually compared to the Gui-Ji-Tang syndrome is very different. If you look at point you to the dosage in itself. In Ma Huang Tang, Zhiganchao is only 3 grams compared to 6 grams in Gui-Ji-Tang, right? In here, Zhiganchao is more playing the role of harmonizing, or at best, use what a lot of the textbook describe as kind of slow down Ma Huang a little bit so that it won't run and be gone in half an hour. Okay, but that's, you can see the difference between these two formulas, as they are very much different because they have different therapeutic principle and method behind it, right? Because of the diagnosis, one where we have an excess condition, and the other side we have a deficient condition. Okay, we just talked about where different patient constitution, even with the same pathogenic factor, can create different syndrome. And where we talked about even earlier, where how you would prescribe formula, you most likely will be applying a formula to a specific syndrome, or there's multiple formulas to select from for a specific syndrome. The problem with that is you're gonna need a lot of formulas, even though, you know, from the textbook it described as being 9 major types of patient constitution. But in reality, when you're practicing, you're never going to see, well, very unlikely going to see any of those types having a patient fit in there perfectly into any of those types. It is most likely going to be a combination of them. It could be one or more. They were waiting between the differences between, say, a deficient and an excess in different organs or meridians or channels is certainly going to be different. So basically, you're going to end up with a lot, I mean, almost countless amount of different patient constitution due to those factors. And if even with the same pathogenic factor, you're going to require a lot of different formulas because their syndrome is going to be very slightly depending on this constitution. So the point I'm trying to make here is really like, how many formulas do we really need? Well, if you're going to apply formula this way, where you are actually associating a formula or more than one formula to a syndrome, then you're going to need, well, practically a lot more than you can available for selection. Because body health status is a continuum. It's not just a scatter points along it. So you could be having millions of combinations in terms of syndromes along this continuum, and you will only have some scatter points as being diseases. So I would say, if you're going to address all the patient's syndrome as they come into your clinic, you're going to need millions of formulas. I don't think that's a very smart way of doing it, and I don't think that's being a sustainable way of doing it. Then you will ask about, well, how about combining one or more formula? That way we can better address all the syndromes. Well, the fundamental problem of needing formulas to cover all possible combination of pathogenesis still exists. So you still have a lot of formulas, right? And matching to the exact pathogenesis of the patient becomes more difficult as the complexity of the pathogenesis that makes up the condition grows, right? And it becomes even more difficult because you have, by combining more and more formulas, that you have a lot more unnecessary herbs introduced into the formula, which will interfere with the effectiveness of the treatment, right? Because you are actually scattering or really infusing into the formula multiple directions that may at the end going to decrease the effectiveness of the treatment. So maintaining perfect alignment to the therapeutic principle and method becomes exponentially difficult as you add more and more formulas to your prescription. So basically you need more and more and more, and it will be a never-ending search, right? We just looked at one pathogenic factor, but if you look at many other types of diseases, well, you'll get like deficient cold with cancer, deficient cold with coronary artery diseases. You're going to have deficient cold with chronic kidney disease, deficient cold with hypertension, deficient cold with diabetes, and so on and so on. And I use the allopathic medicine disease names here. I didn't even use the Chinese medicine ways in terms of describing pathogenesis, because those are even more complex and in numbers. So anyway, the point I'm trying to make across is, as you have more complexities, okay, in the patient constitution, you are going to need an infinite amount of formulas just to cover all the possible combination. Just look at this, okay? How many formulas that we have accumulated so far? Song Hun actually has 113 formulas, right? And then we proceed a couple of hundred years later to Chen Jing Yi Wang at 2,000 formulas. And then coming to later centuries, you get to 5,300s to 16,000 to 61,000, and now we're probably over closer to 100,000, 100,000 plus. That's just one compendium. Sounds like a lot, but compared to the potential combination of the conditions that you have, that's just a small percentage. So even you memorize all of this, you will not be able to cover all the possible combination of constitution and pathogenic factors, which is cause a just almost infinite amount of pathogenesis. So what are the identified problems? Well, number one is you're going to need millions of formulas to cover the number of possible syndromes, and it will become increasingly challenging to maintain the alignment to the treatment principle and method. Even though you're going to combine multiple, even more so if you're going to combine with multiple formulas, because it could be a dosage issue, it could be the extra herbs in the prescription that are required, and it is going to diffuse the focus of the treatment, right? It is not going to be able to align to the treatment focus, to the treatment principle, to the treatment method. And at the end of the day, that will significantly, right, be negatively impacting on the effectiveness of your prescription. Okay, well, here we have two pictures. I'm going to try to use these two pictures to kind of explain to you how this can cause an issue. On your left hand side, the picture on there is showing a simple jar shape. And this jar shape, you can compare to the treatment principle and method, where it needs a certain volume, a certain shape, a certain direction. So that jar represents the principle and the method. And if you have a formula or multiple formulas, so in this example, if you look at the core, there's the biggest piece of rock in the core formula inserted to be prescribed along the principle and method stated, and then to address the other openings or requirements in the principle and methods, you're kind of adding other little formulas here and there, trying to fill up the space. And at the end, you're going to have a prescription that does not completely match the requirements of the treatment principle and method. That's very simple, probably principle and treatment method. If you look at a more complex one, if you look at the right hand side picture we have here, is a much more complex shape, glass structure, representing a very complex treatment method and principle. And if you're going to fill that with rocks that represent formulas, then you're going to have a lot of trouble. Imagine that, filling a simple jar and having a lot of space open, and having a very complex shaped object and trying to fill those using the same method is not going to get anywhere close. And the only way you're going to fill that effectively is with the smallest piece of structure that you can find. And it may be not a liquid, but at least to the point where you're using sand versus stones, right? Where each grain of sand may represent a herb that you will prescribe. That way, you'll be able to have the maximum flexibility to prescribe the treatment in alignment to the therapeutic principle and method that you have determined that will best address the patient's condition. So why do we have formula books? Well, I came up with three major reasons for it. One, it's really for lay persons, and when I say lay person, that means really your average public who may have a disease or condition. And you know what? In the old days in China, having a qualified doctor nearby is very much a luxury, especially in really far-flung villages or small towns, rural areas. The availability of a qualified doctor, pretty slim. And to traveling to a larger town with more options or more chances of finding a qualified doctor, well, good luck with that. It could be a long way, and you don't have trains, you don't have a car, you really pretty much you're walking. Okay, either you're walking or you're riding a mule or a horse. Having a horse probably is a luxury for most of these folks who live that far. Maybe a mule, but anyway, either way, it's not really probably feasible for certain type of patients with especially acute syndrome or more serious conditions to be traveling for days, on very rough ride going to find a doctor, and that's no guarantee that you'll find one. So having of the formula books with descriptions of symptoms that they're able to address is certainly something that is more convenient and may available to them, that they can at least try something to get a treatment. The second one is really for sharing knowledge. We have very qualified, very, very experienced clinicians throughout the Chinese medicine history, and sharing practice results is a great way to help others to learn. But the important thing here is to remember that they are meant to be case studies. They are meant to look at how a specific syndrome or disease are treated and what the formula they have used. And what I mean formula is how actually they have constructed the formulas using specific types of herbs that address specific syndrome, right? So it is about herbology, right? How you actually combine sets of herbs to focus on a specific organ, a specific channel, and a specific action to address the condition. And the last one here is really about emergency situation. And the emergency situation can come up where you have acute epidemic scenario. So we're gonna bound to have epidemic scenario where there is a widespread acute disease that's spreading like wildfire across a geographic region with a large population. And with that, when we have doctors going into these areas, is to put things, the situation under control. It's very critical that they're able to go in there and be able to give some kind of treatment that allows them to buy time. Really, it's really to say, okay, let's save the life first and we'll treat the condition later, right? So formulas like Sini Tang from Sanhongren can be very useful, but there are many others. So that's probably, in clinical terms, the best example that I could think of, that be using a standard formula, just boil, get the herbs at the right dosage and just boil it and just distribute it. But coming back to how we should be practicing, how we should be prescribing, and it only comes back down to the fundamental clinical framework where I'm on this slide here. So I'm gonna go over this really carefully. So as compared to the earlier slide, a similar slide like this, with this one we're looking about a high resolution diagnosis, right? And that's done through syndrome differentiation, where we have identified the disease or syndrome. We should also know about the pathology of the disease, the etiology of the disease, and the pathogenesis and channel combination. Okay, well, not only do we need to understand what is causing the disease or condition, we have to understand where these pathogenesis exists, right? To say that is in the body, that's not good enough. You will not have enough details to prescribe properly. Okay, that is what I state here is probably the minimum that you need to perform a high resolution diagnosis that will support for you to derive the treatment principle, the method, and then to prescribe from there. Right? So really the next step is determine the treatment. Right? The therapeutic principle and the therapeutic method must be stated so that it actually addresses what you have stated in your diagnosis of the condition. So is it wind heat? Is it wind cold? Is it excess? Is it deficient? What is excess? What is deficient? Right? Is it blood deficiency, yin deficiency? Where is the deficiency? Right? So your diagnosis will directly drive the way that you will derive your principle and method, and that those in a way would directly translate to how you prescribe, because that's how you, in your prescription, you address the pathogenesis wherever they may be. Okay, it has to be a combination of the pathogenesis and its location when you're selecting the herbs for your formula, right? So that you construct the formula herb by herb or point by point. If you're doing acupuncture, there shall not be a single unnecessary element in your formula. Okay, there is, if that particular herbs is not required to address anything, whether it's a pathogenesis, whether it is going to be a guide, if it's not necessary, we will not include it in the prescription, because the inclusion of any of those extra herbs, it will degrade the effectiveness of that prescription. Okay, so I think this has come to the end of our presentation. I hope this presentation has given you a clarification on why using formula in a clinical practice situation is not feasible, it is not appropriate, and you will not get the results that you'll be looking for. And hopefully that in the later episodes that we'll have gone on to explain some of the foundational topics that will help you build the necessary background and knowledge to perform a high resolution diagnosis. You know, how you can actually determine the appropriate therapeutic principle and method and actually prescribe it from there. So there's a lot of topics that we'll be talking about coming up. So it could be like herbal medicine, it could be formula construction, it could be syndrome distillation for high resolution diagnosis. We could go on to some, maybe also coming to touch on the fundamental concepts like yin and yang for TCM, 5 elements. Is it relevant this day and age, or is it that we need to modify that or update that with a more modern model? We also can talk about the elusive qi. There may be as many definition of qi or interpretation of qi as there is in stars. So we definitely will talk about that. Another topic that we appreciate and I love to talk about is really cancer through the lens of TCM. And certainly there are many other topics that we'll be talking about in the future, and we're welcome to let us know any topics that you think can help you, right? For the general public, we'll come up with a series just for them, really talk about some of the issues the knowledge around what is Chinese medicine, how it can help you, how the Chinese medicine see some of the more popular things, such as taking supplements, doing exercise, dietary information. So watch out for that. And we will be creating MHO series, my humble opinion series, kind of really presenting some interesting topics that I think will be interested by some of the researchers out there. One of the topics is on pulse reading and technology, and then the one's about bad terminology and even worse translation in TCM textbooks. All right, thank you very much. We'll see you on the next episode.